Neonatal hypertension. All the dyspneic neonates are not due to the pneumonia or RDS and other common things. Good amount of time, 1 to 2%. In fact, the PICO children neonate can have hypertension. Because of the, we do not measure this BP, they do not look after this part. We do not measure the BP or in the NICU setting, and they are carrying the neonates. It should be, because hypertension is possible over there. Renovascular hypertension by far the commonest, and you see these things after umbilical artery catheterization, renal venous thrombosis, and renal arterial stenosis. Parenchymal disease like autosomal recessive polycystic kidney disease and multicystic kidney dysplasia, the PUG obstruction, pelvic junction obstruction, and acute tubular necrosis, cortical necrosis, they also may have hypertension. So measuring BP in this situation is a must. Bronchopulmonary dysplasia, the coarctation factor, they can present in the neonatal hypertension. So dexamethasone, the theophylline and the aminophylline, a drug given to prevent the PNA, can cause also neonatal hypertension. Apart from that, Wilms tumor, commonest pediatric tumor, and neuroblastoma, that can present as neonatal hypertension. So keeping these differentials in mind, every neonate, dyspneic neonates, critically ill neonates with AKI and other illnesses, the hypervolemic and septic, toxic, they should have the BP measured in every visit and every time. And all the cases should not be taken out of septicemia or pneumonia or bronchiolitis or RDS type 1, 2. So measuring BP. Apart from that, hypertensive neonates do have the left ventricular failure, tachycardia, gallop, and your basal capitations, the jugular venous pressure and the congestive cardiac failure features like hepatomegaly may be difficult. JBV cannot be seen well in below 2 years. So the hepatomegaly, they have the hepatomegaly in the early life, little bit of enlarged 2 to 3 centimeter. So it's not conclusive of the CCF. So take other parameters and then go on seeing the child, the boy is, the girl is hypertensive, give one antihypertension. If the BP is now too high, give IV sodium nitroprusside, labetalol, even the nicardipine and others. When the BP is not that high, you can give orally and follow up these cases until you have some clue or diagnosis and the situation is controlled.